Hello, everyone. I'm very excited to be here. We've been doing a lot of work on the ACVPM CE committee to launch our webinars again. And we have two excellent speakers to get us going. First will be Dr. Suzanne Tomasi, and she's a 2005 graduate of the Ohio State University and went through their residency program that ACVPM actually certifies. She is a past EIS officer with the Centers for Disease Control and Prevention and currently works at CDC and the National Institute for Occupational Safety and Health, or NIOSH, in the Respiratory Health Division. And she has a focus on veterinary occupational health and is an epidemiologist. Our second speaker will be Dr. Colin Basler, also a veterinary epidemiologist with CDC. And he is in the division of foodborne, waterborne, and environmental diseases, where he investigates multi-state foodborne enteric zoonotic disease outbreaks such as Salmonella, E. coli, and Listeria. They have a very exciting program for us, and I also want to credit Dr. Tomasi. She is on the CE committee and is helped to put together our race approval and get our webinars launched again. So I will stop there and let her take over.
Good afternoon, everyone. So just a quick overview of our presentation today. We're going to do a little bit of back and forth just to keep the flow of the content a little easier, with me starting with some background on COVID-19 in the meat and poultry processing industry, and then Dr. Basler covering the epidemiology side, and then jumping back to me with some discussion on the recommendations that we made to these facilities based on the epidemiology and what we found about that's unique about these facilities. Okay, so I'm going to start with some background. And again, I'm not a virologist, so I'm not going to go into detail about this. So this is more the 30,000 foot view of COVID-19, just to get us all on the same page. So some history. So this pandemic started almost a year ago in Wuhan, China. What is currently referred to as COVID-19 is caused by the virus SARS-CoV-2. Early on, many of these patients had an epidemiology linked to a large seafood and live animal market in Wuhan, China. However, later medical health professionals started to identify patients who did not have that same epidemiology link to the animal markets and started to indicate that the virus was spreading from person to person. The first US case was reported on January 21st, 2020. On February 11th, 2020, WHO announced the official name for the SARS-CoV-2 virus as Coronavirus Disease 2019, which was shortened to COVID-19. So as veterinarians, we all learned about coronaviruses in school. We learned in humans that there are many types of coronaviruses, and some commonly cause mild upper respiratory tract illnesses. Many of us have probably even treated patients with coronavirus infections, so we're familiar with the variety of animal species that this family of viruses infects. And we also learned in school that it's rare for animal coronavirus to spread from animals to people. So then comes 2020 with the identification of COVID-19 as a new disease caused by a novel coronavirus that has not been previously seen in humans. So SARS-CoV-2 is thought to spread mainly from person to person, especially between people in close contact and through respiratory droplets produced when an infected person coughs, sneezes, or talks. The respiratory droplets are inhaled or land in the mouths or noses of people who are in close contact. However, people who are not showing symptoms may also spread the virus. Based on the current information from the ongoing COVID-19 pandemic, the virus spreads very easily and sustainably between people. Current data suggests that the virus spreads more efficiently than influenza, but not as efficiently as measles. We're still learning about the virus, how the virus spreads, but it is also thought that the virus may be able to spread through touching surfaces or objects with the virus on it. For example, if a person touches a surface with the virus and then touches their own mouth, nose, or possibly their eyes, the thought is they could become infected. So symptoms of COVID-19 vary and may include the following on this list. And I'm sure we've all seen or heard these lists on the news or read about them. And you've probably also heard that symptoms may appear anywhere from 2 to 14 days after exposure to the virus. COVID-19 symptoms can range from mild to severe. Severe COVID-19 complications may include pneumonia, respiratory failure, sepsis, septic shock, cardiomyopathy, and acute kidney injury. COVID-19 can result in death, especially those with severe symptoms and or comorbidities. Prevention. So we've all heard everyday COVID-19 preventions about avoid touching our faces, especially our eyes, nose, and mouth with unwashed hands. Avoid close contact with others, other people, especially people who are sick. Avoid going out unnecessarily, and when in public, to wear a face mask that covers both our nose and our mouth. If you are out in public and find yourself coughing or sneezing, make sure you cover your mouth with a tissue and then throw it away. Clean and disinfect frequently touched objects or surfaces. Frequently wash your hands with soap and water for at least 20 seconds. When soap and water is not available, alcohol-based hand sanitizers can be an option, but make sure that the alcohol content is at least 60%. And then finally, for the background, I want to cover social distancing. So in addition to wearing a face mask, when you go out in public, we want to make sure we're practicing social distancing. So this is ideally, we use the arbitrary number of 2 arms lengths away or 6 feet apart. It's best to just keep your distance in general and not together in groups or with large crowded spaces. Okay, so now that we talked about some background on SARS-CoV-2 virus and what we currently know about COVID-19. So let's talk about some things that were unique to the meat and poultry processing industry that we found this spring and helped with spreading of the virus from employee to employee. So as veterinarians, the majority of us, if not all of us, have been in a meat and poultry processing facility at least once in our profession. However, I'm guessing most of us, when we were in these facilities, were probably thinking it more with from a veterinarian standpoint, using a veterinary thought process. So I'm going to kind of talk about this from a worker safety and health standpoint. Meat and poultry processing workers work in close proximity to each other over extended work shifts. These workers traditionally work elbow to elbow for up to 10 to 12 hours and often share break rooms, locker rooms, transportation, and sometimes even living quarters. So because of these work environments, they are at increased risk for infection with their primary exposure risk of inhaling infectious droplets created by a coworker who is coughing, talking, and or sneezing. They are at increased risk of infection by touching their nose, eyes, and or mouth after touching a contaminated surface or object when infectious droplets have settled on those objects. Now I'm going to hand it over to Colin to talk about what we learned from the epidemiology looking at the spread of virus in several facilities that we've gone to over the past spring.
Thanks, Suzanne. So on March 24th, the South Dakota Department of Health was notified of a COVID-19 case in an employee from a meat processing facility, which I'll be referring to as Facility A throughout this presentation, in Sioux Falls, South Dakota. By April 2nd, 19 cases had been identified among Facility A employees, and by April 11th, the number of cases among Facility A employees had rapidly increased to 369 cases. The next day, on April 12th, Facility A began a phased closure of their facility, and on April 15th, a CDC team arrived in Sioux Falls to assist with the outbreak investigation. So here's a bit of background information on this particular facility. Facility A is one of the largest pork processing facilities in the country. The facility can process up to 19,500 hogs per day and represents approximately 5% of the U.S. pork production capacity. The facility produces both finished product as well as pork product that is then finished at other facilities. And this meant that closing this facility had negative impacts on other pork processing facilities across the country. The facility is supplied by approximately 550 independent family farms, and the facility employs around 3,700 workers. And it is the 4th largest employer in Sioux Falls. Employees are divided between 2 shifts for slaughter and processing of animals daily, and this is followed by a 3rd shift for facility sanitization and cleaning in the evenings. Facility A employs a fairly diverse workforce, which was illustrated by the variety of languages spoken by facility employees. The top 10 languages spoken in the facility were English, Spanish, Kunama, which is a language spoken in Eritrea, Swahili, Nepali, Tigrinya, Amharic, both of which are languages from Ethiopia, French, Oromo, another Ethiopian language, and Vietnamese. And this really led to some significant challenges when it came to appropriate communications to all of the workers in this facility. So during this investigation, a case was defined as a positive SARS-CoV-2 RT-PCR test result in a person who had an onset of COVID-19 compatible symptoms. Or so a person who had a person with an onset of COVID-19 compatible-like symptoms, or who was tested in the absence of symptoms before April 25th, 2020. All reported cases were investigated by the South Dakota Department of Health, and case investigation data was compared for information provided by Facility A in order to identify cases associated with the facility. So between March 16th and April 25th, 929 cases were identified among Facility A employees. This included 39 cases who ended up being hospitalized, and unfortunately 2 deaths occurred among cases in these employees. This represented approximately 25% of Facility A's workforce. In addition, 210 cases were identified among contacts for Facility A employees. This included 9 hospitalizations and 0 deaths. The cases among contacts represented 8.7% of the 2,400 contacts identified by case investigators. During the same time frame, 1,086 cases were identified among community residents in Sioux Falls, South Dakota. This included 130 hospitalizations and 25 deaths. 64% of employee COVID-19 cases occurred amongst males, and 55% of employee COVID cases occurred amongst workers who aged between 18 and 44 years. This epidemic curve shows the confirmed COVID-19 cases among employees at Facility A in dark blue, as well as their contacts in light blue and community residents in sort of the lightest blue-gray color. And these are all plotted by date of illness onset. Cases peaked among Facility A employees after an enhanced testing program for employees began and before the facility started their phased closure. After the closure, cases among employees continued to drop, while cases among Sioux Falls community residents rose and then sort of leveled off at a higher level for the rest of the time frame of interest. Cases among known contacts of Facility A employees remained low throughout the time frame of interest. Among employees at Facility A, 96% of identified cases were symptomatic. 890 cases occurred among non-salaried employees, which represented about 26% of the total non-salaried employees at the facility. In addition, 39 cases occurred among salaried employees, and this represented about 14% of all salaried employees in the facility. The majority of salaried employees were managerial and administrative staff. Employees were categorized into 7 department groups as determined by the facility's supervisory structure. These groups tended to consist of departments that performed similar functions under similar conditions and received COVID-19 related guidance and communication through similar channels. These groups were cut, conversion, harvest, smoked meat, bacon, sausage, and other. Between March 15th and March 21st, 5 cases were identified among employees in the conversion department group. This represented less than 1% of all employees within that group. 1 additional case was identified in an employee who worked in the bacon department group. By March 28th, cases had occurred among all department groups, with a noticeable spike among employees in the conversion department group. By April 4th, the conversion department group still accounted for the majority of cases at 91, and this represented 15.8% of the conversion group workforce. By April 11th, the 4th week of the outbreak, cases had increased dramatically across all department groups, with cut overtaking conversion for the highest number of cases. At this point in time, an average of 67 employee COVID-19 cases were occurring per day. By April 18th, the harvest department group had joined cut and conversion as the most heavily affected department groups. each of which had COVID-19 cases identified in over 28% of their respective workforces. Within 7 days of the facility closure, new cases among employees had declined to approximately 10 per day. Finally, by April 25th, the number of new cases among employees had dropped substantially. Cases had been identified across all major department groups, with cut, conversion, and harvest being the most heavily affected departments. Rates of infection were also compared for employees by shift. By March 21st, 5 cases had occurred among first shift workers, and 1 case had occurred in a second shift worker. By March 28th, 32 cases had occurred among first shift workers, with only 5 additional cases occurring among second shift workers. As of April 4th, spikes in cases had occurred in both first and second shift workers, and the first cases had occurred amongst the third shift workers. By April 11th, cases had rapidly increased amongst all shifts, with the percentage of cases among third shift workers catching up with the percentage of cases identified amongst first and second shift workers. By April 18th, cases represented more than a quarter of first shift workers. And finally, by April 25th, cases had occurred in 24.6% to 27.8% of each shift, with the highest number of total cases, of 485, occurring among first shift workers. So the findings from this investigation highlight the potential for rapid transmission of COVID-19 among employees in meat processing facilities. Employees tended to work in less than 6 feet apart from one another on the production line in the cut, conversion, and harvest department groups. And these department groups represented the highest number of cases within the facility. Contact between employees in common areas might have facilitated transmission between departments. These common areas included the cafeterias, the locker rooms, and equipment dispersing location. Transmission might have also occurred outside of the facility through carpooling between workers. We had reports of workers cohabitating in the same household, and there's an opportunity for workers to socialize outside of work. This investigation was subject to a number of limitations. The enhanced testing strategy might have led to an increase in case detection among employees compared with the general community at that time. Attack rates stratified by race and ethnicity were not reported because this data was very incomplete. These findings likely underestimate the burden of infection in the facility as well as in the community due to the limited testing of asymptomatic persons during the timeframe of interest. And finally, location of virus acquisition. So if people came in contact with the virus either in the facility or in the community could not be determined for individual employees. So now that we've covered a specific outbreak investigation, I'll provide a brief update on the national perspective for SARS-CoV-2 infections among meat and poultry processing plant workers. And this summary is compiled by colleague Michelle Waltenberg and additional colleagues who participated in this national review. According to the U.S. Department of Labor, the animal slaughtering and processing industry employs an estimated 525,000 workers in approximately 3,500 facilities nationwide. As previously mentioned, distinct factors that affect workers' risk for exposure to SARS-CoV-2 in meat and poultry processing workplaces include the distance between workers, the duration of contact, and the type of contact. These workers often work close to one another on processing lines and may also congregate when clocking in or out. They might congregate during breaks or in locker or changing rooms. Workers often have prolonged closeness to coworkers with up to 10 to 12 hours per shift. On May 1st, CDC released an MMWR on the first national call for data on COVID-19 among meat and poultry processing workers. The report documented 4,913 cases and 20 COVID-19 related deaths among workers from 115 facilities in 19 states. Data for this report was submitted from April 20th to April 27th. A second data call was made for data on COVID-19 among meat and poultry processing facility workers through May 31st. Overall, 28 of 50 states responded to the data call, including 23, or 82%, that reported at least one confirmed COVID-19 case among meat and poultry processing workers from 239 facilities from March to May 2020. As of May 31st, 239 facilities had reported 16,233 COVID-19 cases and 86 COVID-19 related deaths among workers. The median number of affected facilities per state was 7. 6 states that reported the first national data call did not contribute to the second data call. Combining data on workers with COVID-19 from both national data calls as of May 31st, at least 17,358 cases of COVID-19 and 91 COVID-19 related deaths have occurred among meat and poultry processing workers. And these occurred across 264 facilities in the United States. So in early June, CDC requested that state health departments report aggregate surveillance data through May 31st for workers in all meat and poultry processing facilities affected by COVID-19. And this data request included the number and type of meat and poultry processing facilities that had reported at least one confirmed COVID-19 case among workers, the total number of workers in affected facilities, the number of workers with laboratory confirmed COVID-19, and the number of COVID-19 related deaths among workers. States were also asked to report demographic characteristics of age, sex, race, ethnicity, and symptom status for workers with COVID-19, as well as descriptions of interventions and prevention efforts at affected facilities. Among 14 states that reported the total number of workers in affected facilities, 9.1% of the 112,616 workers received diagnosis of COVID-19. The percentage of workers with COVID-19 ranged from 3.1 to 24.5% per facility. 21 states provided information on demographic characteristics and symptom status of workers. Of 12,000 workers with information on sex, 60% of COVID-19 cases occurred among males. Of 12,365 workers with information on age, 46% of COVID-19 cases occurred among workers aged 40 to 59 years. Of 9,919 workers with information on race ethnicity, 56% of COVID-19 cases occurred amongst Hispanic or Latino workers, 19% in non-Hispanic Black workers, 13% in non-Hispanic white workers, and 12% in non-Hispanic Asian workers. Overall, 87% of COVID-19 cases occurred among racial or ethnic minority workers. Methods for collecting symptom data varied by workplace, and symptom status was available for a single time point, either at the time of testing or at the time of interview. Of 10,284 workers with information on symptom status, 88% of workers with COVID-19 were symptomatic, and 12% were either asymptomatic or pre-symptomatic. States provided information from direct observation or from management at affected facilities regarding specified interventions and prevention efforts that were implemented. This table shows information on these efforts for 111 facilities from 14 states. The most commonly reported interventions were screening workers on entry, requiring all workers to wear face coverings, increasing the availability of hand hygiene stations, educating workers on community spread, installing physical barriers between workers when social distancing was not feasible, and staggering shifts to decrease crowding on entry and exit. This is a continuation of the previous table showing interventions implemented by affected facilities. Only 37% of facilities reported offering testing for SARS-CoV-2 to workers. 30% reported removing financial incentives, such as attendance bonuses for workers to continue to work. 22% reported closing temporarily as an intervention measure. 21% reported reducing the rate of animal processing, and 15% reported decreasing crowding of shared transportation to and from the worksite. Demographic characteristics of total worker population in affected facilities were not available, limiting the ability to quantify the degree to which some racial and ethnic minority groups might be disproportionately affected by COVID-19 in this industry. The racial ethnic distribution among cases the racial ethnic distribution among cases was compared to the general workforce using animal slaughter and processing industry data. Among animal slaughter and processing workers from the 21 states who reported race ethnicity among cases, approximately 39% were non-Hispanic white, 30% were Hispanic or Latino, 25% were non-Hispanic Black, and 6% were non-Hispanic Asian. However, among workers with COVID-19 with reported race ethnicity, 56% were Hispanic or Latino, and 12% were non-Hispanic Asian, suggesting that non-Hispanic Asian and Hispanic or Latino workers might be disproportionately affected by COVID-19 in this workplace setting. Ongoing efforts to reduce incidents and better understand the effects of COVID-19 on the health of racial and ethnic minorities are important to ensure that workplace-specific prevention strategies and intervention messages are tailored to those groups most affected by COVID-19. Among workers with known symptom status, 12% were either asymptomatic or pre-symptomatic. However, these infections are more likely to be identified in facilities that performed facility-wide testing. Since not all facilities tested all employees, many asymptomatic and pre-symptomatic infections in the overall workforce were likely not captured. And these approximations for disease prevalence might underestimate SARS-CoV-2 infections among workers. I'd like to note that this analysis is subject to a few limitations. These results might not be representative of all U.S. meat and poultry processing facilities and workers, as not all states responded to the data call, and only facilities with at least one laboratory-confirmed case of COVID-19 among workers were included. These approximations for disease prevalence might underestimate SARS-CoV-2 infections among workers due to delays in identifying workplace outbreaks and variations in testing availability and practices. Information on interventions was available for a subset of affected facilities and might not be generalizable to all facilities. The information was also subject to self-report by facility management, and all available intervention efforts might not have been captured. Further evaluation of the extent of control measures and timing of implementations is needed to assess effectiveness of control measures. Finally, workers in this industry are members of their local communities, and their source of exposure and infection could not be determined for those living in communities experiencing widespread transmission. Exposure might have occurred within the surrounding community as well as at the work site. I'd also like to note that many meat and poultry workers are from many different countries, languages, cultures, and immigration statuses, including refugees. Culturally and linguistically appropriate public health monitoring and interventions, including access to interpreters, are critical for this workforce population. I'd like to now turn things back over to Dr. Tomasi.
So now I'd like to talk about what are we going to do with this information and what recommendations do we provide for these facilities. So the first recommendation we made was for the facility to create a COVID-19 assessment and control plan. And the first component of the plan was to identify a qualified workplace coordinator. This individual was not only responsible for creating the COVID-19 assessment plan, but also coordinating with the state and local health department and occupational safety and health professionals. This individual should also be knowledgeable about public health guidelines and federal regulations. And this person should be listed somewhere in the facility so that if any questions arise, both supervisors and employees know who to contact for questions. Another thing when developing the COVID-19 assessment control plan is workplaces were recommended to do an initial assessment for initial hazard and risk assessment following the exposure risk factors and exposure routes. Then after an initial one was done, we recommended a periodic hazard assessment to identify how the initial controls were working and if any changes need to be made. And then make sure within these plans we include COVID-19 testing plans as well as plans for contact tracing of workers who test positive to COVID-19. So being from NIOSH, we always have to talk about the hierarchy of control. So for our COVID-19 assessment control plan, CDC NIOSH recommendations are based on this hierarchy of control. This approach groups actions by their effectiveness in reducing or removing hazards. So if you look at the slide, at the top of the slide where it says elimination, that is the most effective form of removing a hazard down to PPE, which is the least effective at removing it. However, in most cases, specifically when we're talking about COVID-19, completely eliminating the pathogen from the work site is not feasible. So we're going to focus on engineering and administrative controls with some focus on PPE. So starting with administrative controls. So here are some examples. So one thing we want to first look at, because this seems to be a common theme that we were seeing both in our epidemiology side of things as well as our on-site evaluations, is trying to find a way to modify workstations to maintain 6 feet of separation among workers in all directions. We also recommended using markings or signage as a reminder to employees to maintain their distance. As humans, we're not used to thinking from a social distance standpoint. So here I'd like to show you an infographic that we developed to demonstrate. At the top, it's in red, it says bad, but you can think of that not necessarily bad, but more pre-COVID-19 setup of how meat and poultry processing facilities work. So you'd have employees standing very close together and across from each other on these lines. So to help provide recommendations so that employers could improve social distancing on the line, we gave them a couple different options that were all acceptable based on our current knowledge. So one, we could just provide 6 feet apart between employees and remove the worker that's across from each employee. However, if you know anything about meat and poultry processing facilities, you're probably thinking, well, you need to slow down the line speed there to still be able to keep up with the source of the meat that's coming through. So another option is provide a barrier between the two employees, but still remove the worker that is opposite of that one. And then finally, you can keep your original setup, but now you need a partition between and in front of the employees so that you basically have each employee segregated off from the other employees. So this is using physical barriers between workers. And so with this recommendation, and we gave the option of using things like strip curtains and plexiglass, but we always stress to the facilities that we are not experts in food safety guidelines. So we stress that they work with the USDA to determine which would be the best material to use for these physical barriers. Another recommendation we looked at was looking at ventilation in the areas. And so again, we didn't have the expertise to come in and provide individual consults. So we stressed to facilities they should contact or consult with a qualified heating and ventilation and air conditioning engineer to address that. And then another recommendation, because meat and poultry facilities can have areas of heat stress, they use a lot of personal cooling fans to cool down employees or help prevent heat stress hazards. The problem with this from a COVID standpoint is the blowing from these fans can blow the virus from one worker to another. So we recommended either redirecting these fans if possible, and if they couldn't, to remove them. However, if you had to remove them, you need to take other precautions for heat hazards. Some of these next controls I'm going to talk about kind of overlap between engineering and administrative controls. So we also recommended that a lot of these facilities increase the number of hand washing stations or hand sanitizing stations that they had available for employees, preferably touch-free stations. Like Dr. Basler said, one of the things we saw was there's congregation at the clock in and clock out stations. So recommended adding some engineering controls to decrease the density of the clock in, clock out stations. So one thing we recommend is maybe adding more clock in, clock out stations, staggering times for workers to clock in and clock out. And some of the older facilities had touch ones where the employees had to touch the clock in and clock out station. We recommended that they, if it was affordable, to employ touch-free clock in and clock out stations so that you don't have to worry about contacting there. Then we want to think about increasing worker separation in areas outside or away from the production floor. So areas where we were concerned about congregating or high density of employees, like in the break rooms, the lunch rooms. So things that we recommended here was rearranging chairs and tables so that they were 6 feet apart, or removing tables and chairs so they were 6 feet apart and you had space, putting dividers on tables and chairs so that people were eating kind of in a segregated section. The other thing is using training areas and conference rooms, since we weren't using conference rooms for conferences during this pandemic, to use them as potentially additional training, additional lunch areas or break rooms. And then a lot of these facilities we were looking at in the spring, and so the weather was starting to warm up, and we were suggesting that they even look into putting tents outside for break areas and lunch areas to help decrease the concentration in the current lunchrooms and common areas. However, going into winter, that might not be an option anymore. Okay, so let's talk about some administrative controls. So these are policies that the facility needs or should put into place to help to mitigate the spread of COVID-19. So one of the things we recommended is enforcing a policy of single file movement throughout the facility using with workers separated by 6 feet. And potentially assigning workers at the facility to enforce this separation. So their whole goal is to be on the lookout for people who forget about social distancing and remind them to social distance. Another administrative control we recommended is providing floor markings and signs as visual cues to remind employees to do this. And just like Colin stressed, and I can't stress this enough, is when you do markings and signs, you got to think about the languages the employees speak, as well as the reading levels that these employees are able to. So these signs and these markings need to be within those communication standards. And then one of the things we also recommended is looking into staggering, seeing if it's possible to stagger break times, arrival, departure times to minimize congregating in parking areas, locker rooms, or near time clock. Like Dr. Basler said, a lot of these employees had to carpool to get to work. And so we definitely recommended, as the first recommendation, is to try to avoid carpooling. However, in a lot of these scenarios, these workers couldn't get to work if they didn't use carpooling. So we provided some guidelines on things that the company should educate the workers on if carpooling has to take place, like practicing hand hygiene before and after carpooling, wear a face mask while in the car, and disinfect the car routinely. And I'll show you later, we have some infographics that we have developed that facilities can use as signs and postages to remind employees of this. We also suggested they modify their process or production lines, shift schedules, or stagger shifts. So this could be a couple different ways. We could take one shift and turn it into 2 or 3 shifts. We could also recommend considering adding another shift for just cleaning. And I'm not talking about the standard food safety sanitizing that these facilities have to do to meet their food safety guidelines and requirements. I'm talking about a cleaning shift that is COVID-19 cleaning of high-touch surface areas, locker rooms, conference rooms, lunch areas, break areas. So another recommendation we had for these facilities is make sure they're monitoring and responding to absenteeism. So as COVID-19 spreads for the facility or even the community, we expect employees to have to report off or be out of work for up to 14 days. Because we are talking about critical infrastructures for our national and world food security, these facilities need to have plans in place so that they can continue business even when they are experiencing 50% absenteeism. We also recommend these facilities make sure that they review their leave and incentive policies. Like Dr. Basler mentioned, some of these places had incentives for perfect attendance prior to COVID-19, and we recommended they remove those because if you think about employees that are living paycheck to paycheck, if they're mild symptoms, they might still come to work because they need the money. So we want to make sure that there's no incentive for them to come to work. And another thing we've noticed in our investigations and through the EPI studies is that a lot of these facilities were providing 14 days of paid leave time for employees that were tested positive and or were considered a contact to somebody who tested positive. But there was miscommunication between the upper level management who had installed these policies and the unions and the employees that were actually these policies were impacting. So when we talked to employees, they weren't aware of these there. So we want to make sure that communication is reaching all levels. And again, that goes back to language and literacy level, making sure that they're done in ways that employees understand. We also recommend looking into possibly making flexible sick leave policies, like people could pull from future sick leave or allow employees to donate sick leave to other employees. Another thing we recommended, and again, this isn't for all facilities, but consider cohorting or grouping workers so that with this thought process is we're keeping groups together, and that if somebody does become positive, we potentially confine the number of exposure and it's easier to contact trace. But again, not all facilities this is feasible in. We also recommend they establish a reporting system for workers who do become sick, know who to contact and report their illness to, and that these systems need to maintain confidentiality with the American Disabilities Act. And then providing education to the workers on how they can avoid becoming exposed and things they can do to protect themselves, which includes not touching your face, and making sure you wash your hands before and after you remove your PPE. Another administrative control that we recommended was make sure workers have access to soap, clean running water, and single-use paper towels. If they couldn't find a way to increase the number of hand washing stations, then we definitely told them that hand sanitizers were an option in multiple locations, particularly through doorways, down stairwells, places like commonly used areas or round high-touch surfaces. Again, I go back to stressing that for alcohol-based hand sanitizers, making sure that the minimum alcohol level is 60%. Stress that workplace programs should promote personal hygiene, such as increasing breaks to find time to wash or sanitize hands, use touch-free trash receptacles, and educate about avoiding tobacco products. The last part of the hierarchy control is the personal protective equipment. And I'm going to stress right now, this does not include face masks. This is PPE like respirators, gloves, goggles, etc. And so being from NIOSH, we always recommend that they do a hazard assessment to determine which PPE needs to be used in the facility, to make sure they're following the OSHA PPE standards. When we're talking in the time of COVID, though, because you have to provide training on PPE, we need to assess how we're doing these trainings. We need to find ways to do these trainings. If we're doing them in person, we want to do them in person in smaller groups and maintain social distance. But another option right now is to use videos for training on PPE. In the time of COVID, we want to stress with PPE that's being used in the facilities that they're thinking about care when donning and doffing PPE. So we reminded facilities they need to train workers being careful of making sure they're washing their hands before and after putting PPE on. Recommended PPE be disposable if possible, but if not, if they use reusable PPE, to make sure it's properly disinfected and stored in a clean location. And then PPE should not be taken home or shared between employees. Face shields we've put those under the PPE or category, and we found during our evaluations in the spring, a lot of meat and poultry processing facilities were using face shields. So these can be very helpful to minimize contamination of face masks, not to be used in place of face masks though. And if face shields are used, they should be cleaned and decontaminated after each shift, and then stored in a clean location at the facility. And we want to make sure the face shield fits correctly. So it should wrap around the sides of the wearer's face and extend below the chin. Okay, so time of COVID, and we had a cleaning and disinfectant recommendations. And again, I stress this is outside the food safety sanitizing process. So we recommended these facilities look at cleaning and disinfecting of tools in between or not outside the time of their food safety sanitizing process. So anytime workers exchange tools or workstations, we want to make sure we're cleaning that tool. We also made sure the facilities were aware of the EPA registered disinfectant list, the list N. This is a list of disinfectants that are used against SARS-CoV-2. However, we also stress that we are not up to date on the food safety standards, so to work with our USDA staff to ensure compliance with those standards when picking a disinfectant for SARS-CoV-2. So in addition to cleaning the disinfecting tools and equipment, we also recommended facilities do a cleaning and disinfectant process on frequently touched surfaces within the workspace and common areas, such as door handles, handrails, barriers, bathrooms, lunch areas. This is where, when I was talking about assign a specific shift to doing the cleaning and disinfecting, this is one of the part of where that recommendation came in. So now you've got a new group of people that might be exposed to a new hazard. So when you're using these cleaning disinfectant tools, we reminded the facilities that they might need to look at additional PPE for these people, which then also meant they had to have a hazard communication program and training in place for these individuals. Okay, face masks. So unlike PPE, which is designed to protect the wearer, face masks are designed to protect the people around the wearer. And big difference there. And we try to stress this anytime we're talking to people about face masks. That's why we don't put it in the face mask group. But this can be a protective measure to provide in addition to social distancing. And like I said, I stress, it's not PPE. With face masks, for When facilities are using those, we stress that they need to fit over the nose and mouth. They need to fit snugly and comfortably against the sides of the face. They need to be secured with ties and loops around the ears and be multiple layers of fabric. They need to allow breathing without restrictions. And this is the part with meat and poultry processing facilities where the face shield came into handy. If they became wet or contaminated, they need to be replaced immediately with a clean replacement provided by the employer. If the company allowed reusable face masks, we stress that they need to be laundered daily, and each day the employee should start off with a clean cloth or face mask. Okay, so in the time of COVID, we also have to educate and train workers and supervisors. So again, I can't stress this enough with this workforce. These materials need to be in languages that are understood by the majority of the workers, in reading or literacy levels understood by the majority of the workers. So some of the facilities we went into, we saw like anywhere from 20 to 80 different languages spoken to the facilities. In one facility, we were told by the union that the literacy level was at a second grade reading level. So if all your material is in English and at an 8th grade reading level, there's definitely an area where workers are not getting the training and education they need. When we're talking about training and education, posters can be a great source, and we want to put these in areas where they would be commonly seen by the workforce. So building entrances, break areas, common areas, locker rooms. These, again, should be legible at a distance in languages that are spoken by the majority of the worker population. Okay, the next group I'm going to talk about is managing the workforce. And so starting with managing the workforce, we want to talk about screening and monitoring the workers. And so first thing, these policies need to be worked with the state and local health officials and maybe even occupational medicine professionals. And some options that we recommended for screening the workforce when they came into the facility was either a verbal screening of symptoms, or even now we've seen some facilities where they're doing a text message or an app online where the individual reports if they've had any change in symptoms or new symptoms developed in the past 24 hours. Some facilities were checking temperatures. So anybody who had a fever of 100.4 or greater usually would either be sent home or receive a secondary screening to confirm that fever. So for screening and monitoring of workers, if you're doing it in person, then we had to think about for these facilities, are we protecting the person that is doing the screening and monitoring? So if it was done in person, not on an app, then we need to look and see, was that person able to maintain 6 feet of distance between the workers as they were coming into the facility and being screened, or was that person closer than 6 feet? If they were could maintain the distance, a face mask might be enough for them for protection, but if they were closer, then these individuals needed to have more PPE, like gloves, gown, face shield, maybe an N95 respirator. So with managing the workers, we also have to think of what to do with sick workers. So when workers showed up with symptoms or developed symptoms during the day, there should be a policy in place of what to do with those individuals. And then once they've gone home, what to do with their workstation, who to notify. And this all needs to be done while at the same time maintaining that worker's confidentiality in accordance with the Americans with Disabilities Act. Meat and poultry processing facilities are listed under critical infrastructure employers. There's a little bit difference in guidelines from this and other facilities for coming back to work. So if you've got an employee that has been exposed, is asymptomatic, and is not tested positive to COVID-19, under the CDC critical infrastructure guidance, which I can provide links to if somebody wants that information, these employees are allowed to return to work, providing extra precautions can be taken within the guidance to minimize exposure to other workers. When we're talking about returning workers who have tested positive for COVID-19, there is the resource of discontinuation of isolations for persons with COVID-19 not in healthcare settings. That is regularly updated and a great resource. Okay, the last bit of things I want to talk about here, and then I will be done, is we did, from our experiences this spring in the epidemiology, CDC NIOSH developed a meat and poultry assessment tool. And this toolkit, I don't have a picture of it, but basically it has two sides to it. It has a side for public health professionals where it helps guide them going into a facility and doing a COVID-19 assessment of the facility, as well as it has a facility component where it'll help management walk themselves through developing a COVID-19 assessment and control plan. We also, I want to make you aware that we do have a Train the Trainer webinar that are options for local and state health departments who maybe not have the occupational experience or knowledge to go into these facilities and do an assessment. We can provide training. It's about a 1 to 2 hour training depending on how much prior experience the individuals have that we can provide and get from NIOSH to help prepare individuals to go in and do these assessments. The trainings are provided by COVID-19 occupational subject matter experts. They have a question and answer proportion. If you're interested in that, again, just you can reach out to me and I can get you in contact to set something up. So Eric, I'm going to go really quick through these next slides because basically the next 4 slides are just some additional resources, providing some CDC educational materials, some fact sheets, some infographics. Here, I also want to mention we do have the NIOSH Health Hazard Evaluation Program. This one's designed for employees, union officials, employers. Who are concerned about hazards in the workplace, including COVID-19. They can submit a request and we can do an evaluation. I also remind OSHA on-site consultation program is an option to help with this. And then last, I have resources for CDC COVID-19 information and then OSHA COVID-19 information. An acknowledgement slide. And so I know this is I went a little over, but I also want to say that I've only focused on the meat and poultry toolkit that we've developed. However, since that was the first one we developed, we actually have 3 other toolkits, including a seafood processing toolkit, an agricultural toolkit, and a general manufacturing toolkit for other industries and help them kind of walk through and do a COVID-19 assessment and develop a control plan for those industries. I only focused on meat and poultry processing one because that's the topic of this presentation. And thank you very much.
Great. Great job, Dr. Tomasi and Basler. And I know that the audience is giving you a big virtual round of applause. Very good job. We do have some questions. Would you be willing to take just a few and then we will answer the other ones by email?
That works for me.
First question from one of our diplomates. I wonder if employees who are sharing the same house and facility were identified, and if so, what is the relationship to their infection status?
That's a great question. And I think at least for the South Dakota investigation, we had more anecdotal or one-off reports of workers sharing, cohabitating together. We also had workers who lived in the same apartment complexes in the same neighborhoods. So we did not have a good breakdown of like routes of transmission between those workers specifically, but it was definitely something that was brought up as a potential additional, as an additional potential route of transmission in addition to transmission within the workplace.
Okay.
We had reports of some workers living with workers who worked at other slaughter facilities in the region as well.
Next question is, were environmental parameters measured in the various departments of the pork processing facility? For example, temperature, humidity?
So in this situation, no, we have not, we did not evaluate temperature and humidity at the time of these evaluations. I think that information going forward, though, will be something, we're starting to look more into things like humidity, temperature, and ventilation, and how that plays in an impact with transmission of COVID-19.
And I would just add for that particular facility, it was in a fairly older building, and we were able to identify workers by the grouping by sort of the department that but different departments were working in the same general location. So it would have been difficult to tease out sort of by floor or by area other types of environmental exposures.
We will move on to one more question, if that's all right. It gets more into the recommendations. How receptive were the establishments to the recommendations for social distancing along the production lines and modifying work shifts?
So when we look at social distancing on the work lines, like putting up the physical barriers, they seemed very receptive to those. They were receptive to adding the shifts for cleaning. We definitely saw, and we've actually saw some creative ways to approach some of these guidelines. One facility we went to, and this isn't the South Dakota facility, this is another one, where we went in and they had already established a whole shift for cleaning and disinfecting high touch surface areas. And they had one individual stationed in the lunchroom, and they would put green and red cards on the lunch tables. And so red card meant they hadn't disinfected it yet, and green card meant that table had been disinfected. So from that standpoint, as far as modifying the shifts, I'm not sure how receptive they were to that. These are businesses at the end of the day, right? So they got to be productive too.
And this is a question, and it's one of my questions too. Were there any similarities identified between cut and conversion that might have promoted spread? And my question, what happens in the conversion section?
So cut and conversion were both relied on high numbers of workers working in sort of close proximity along production lines, and not just close proximity next to each other, but also close proximity sort of directly across the line. So before some of those plexiglass barriers were put in place, and this a lot of potential for transmission between longer shifts. I think cut was in earlier stages of processing, and conversion was some of the initial processing, like some of the second round processing before product went to the bacon or other smoked meats or the other more specific processing lines.
There are quite a few people that work under similar conditions as these meat and poultry processing plants. Why focus on this particular facility? Was there a specific interest? Was there a specific reason you went to this facility?
So, Colin, I guess I'll take that one first. So, so Colin focused on the South Dakota facility because that was probably that was called as an EPI-aid originally, and I don't know if anyone knows what that means. But basically, the state reached out to CDC and asked us to come and look at this. And at the time, the governor also ordered this facility to close down. But at the state, from a NIOSH worker safety health team component, we didn't just focus on this facility. We actually got called into over 29 different facilities. And then after being in numerous facilities, we actually started helping facilities and local and state health departments virtually. So because we felt like we had seen enough that we could actually start making recommendations and providing assistance when they were reaching out to us because cases were popping up. And then it just, I think it happened or started in the meat and poultry processing facilities because these are critical infrastructure facilities. So during the shutdown in mid-March to the beginning of April, these facilities continued to operate. Whereas other facilities that work under similar circumstances that weren't classified as a critical infrastructure actually did temporarily close down. But as things started reopening from a worker safety health standpoint, our team actually started getting reach outs from other state and local health departments about other facilities that weren't meat and poultry processing. And so that's where the development of the general manufacturing toolkit that I briefly mentioned came from, is because you're right, this is not just a meat. These working conditions do not just fall under meat and poultry processing facilities.
Yeah, I would just add that this was by far at the point in time at March and April, this was one of the largest sort of point source outbreaks that was happening in the country, and the only second one identified in a meat processing facility. And, as Suzanne has mentioned, that we're starting to see outbreaks occur in many other facilities later on down the line. I think early on, there was a lot of concern that multiple outbreaks in these types of facilities could lead to concerns about adequate food supply or concerns about food shortages. And then we did also start to see similar outbreaks transition over into more agricultural settings and seafood production facilities. And I think that's why we also have those more specific guidance documents for those other workplace settings as well.
All right, and one last question. Can you comment on how much establishments modified their sanitation programs to address COVID-19?
Yeah, I don't know about the food safety sanitizing component that, that we are not subject matter expert. When I say we, NIOSH CDC is not subject matter experts on the food safety sanitizing component of it. But as far as the general cleaning and disinfecting from a COVID-19 standpoint, we definitely did see an uptick in acceptance of those policies, increasing the number of hand sanitizing stations throughout, having employees assigned to go around and clean high touch surface areas, somebody assigned to the lunchroom to clean between groups coming in and out of the lunch shift, so that we're constantly having a disinfecting cleaning process going on there. So from that standpoint, yes, we saw a very nice uptick in acceptance of those guidances.
So I thank you, everyone. Please have a healthy and safe day.